Question 1. An RBT is trying to figure out why a child screams during transitions between activities. They observe the child, noting what happens right before the screaming itself, and what happens immediately after. What is the RBT doing? A. Conducting a preference assessment. B. Implementing a skill acquisition plan. C. Collecting ABC data. D. Using a token economy. Answer: C. Collecting ABC data. This question asks about a specific type of data collection used to understand why a behavior is happening. The keywords are what happens right before, the screaming itself, and what happens immediately after. This directly points to collecting information on the antecedent, behavior, and consequence, which is known as ABC data collection. A preference assessment finds what the client likes. Implementing a skill acquisition plan is teaching a new skill. A token economy is a reinforcement system. ABC data is specifically used to analyze the context surrounding a behavior to figure out its function. It's like being a detective and gathering clues about the behavior. Question 2. Which scenario best describes negative reinforcement? A. Giving a child a sticker for sitting nicely, which increases sitting nicely. B. Taking away a toy when a child hits, which decreases hitting. C. A child cleaning their room to stop their parent from nagging, which increases room cleaning. D. Telling a child no loudly when they run away, which decreases running away. Answer: C. A child cleaning their room to stop their parent from nagging, which increases room cleaning. This question tests your understanding of negative reinforcement. Remember, negative means taking something away, and reinforcement means the behavior increases. In option C, the unpleasant stimulus, nagging parent is removed when the child performs the behavior, cleaning room, and this makes the behavior, cleaning room, increase in the future. Option A is positive reinforcement. Adding sticker, behavior increases. Option B is negative punishment. Taking away toy, behavior decreases. Option D is positive punishment. Adding loud no, behavior decreases. Negative reinforcement is escaping or avoiding something unpleasant, which makes the behavior you use to escape happen more often. Question 3. Your supervisor asks you to track the rate of a client's hand flapping. Which two pieces of information do you need to calculate rate? A. Frequency and duration. B. Frequency and time. C. Duration and time. D. Topography and frequency. Answer: B. Frequency and time. This question is asking about how to calculate the rate of a behavior, which can sometimes be confused with just counting how often it happens. The keyword is rate. Rate is the number of times a behavior occurs, frequency, divided by the amount of time you were observing. So you need both the count, frequency, and the total observation time to get the rate example, 10 hand flaps per hour. Duration is how long the behavior lasts. Topography is what it looks like. To get a rate, you always need a count over a period of time. Rate puts the count into perspective. Question 4. A client is learning to identify objects. The RBT holds up a picture of a dog and says, dog. What verbal operant is the RBT prompting for if they want the client to say dog? A. Mand. B. Tact. C. Trog. D. Intraverbal. Answer: C. Entroik. This question is about verbal operants and how they are prompted. The scenario describes the RBT saying a word, dog, and wanting the client to repeat that exact word, dog. This is the definition of an echoic, repeating what someone else said. A mand is asking for something. A tact is labeling something seen / heard / etc. And an intraverbal is like conversational fill in the blanks. When you say something and want the learner to say exactly the same thing back, you're prompting an echoic. Say what I say. Question 5. When teaching a new skill using forward chaining, what is reinforced after the client correctly completes the first step? A. Only the first step. B. the first step and the second step. C, the last step. D, all steps in the chain. Answer: A, only the first step. This question tests your understanding of forward chaining. In forward chaining, you teach the task steps in their natural order, starting from the beginning. The reinforcement is delivered once the client successfully completes the current step being taught independently, with the RBT doing the rest. So when you start teaching, you only reinforce the successful completion of the first step. Once that's mastered, you teach the first two steps and reinforce after the second one is completed independently, and so on. It's building the chain from the start, one link at a time. Question 6. An RBT wants to decrease a client's habit of interrupting conversations. The behavior plan says to provide praise and attention whenever the client waits for a pause in the conversation before speaking. What behavior reduction procedure is this primarily using? A, extinction. B, punishment. C, differential reinforcement. D, response cost. Answer: C, differential reinforcement. This question describes a common strategy for reducing unwanted behavior by increasing a more appropriate one. The keywords are decrease, interrupting, and provide praise and attention whenever the client waits. This is an example of differential reinforcement of an alternative behavior, DRA, where you reinforce a desired behavior, waiting, while not reinforcing the unwanted behavior, interrupting, which was likely reinforced by attention before. Extinction involves withholding reinforcement entirely. Punishment decreases behavior using a consequence. Response cost is a type of negative punishment where reinforcement is taken away. Differential reinforcement is about rewarding the good behavior instead of the challenging one. Question 7. When prioritizing which behavior to target for decrease, which of the following is typically the most important factor? A, how annoying the behavior is to the RBT. B, how easy the behavior is to measure. C, how dangerous the behavior is to the client or others. D, how often the behavior occurs. Answer: C, how dangerous the behavior is to the client or others. This question is about the ethical and practical considerations when choosing behaviors to work on, while how often a behavior occurs or how easy it is to measure are important factors in understanding it. The most crucial factor when deciding which challenging behavior to decrease is safety. Behaviors that cause harm to the client, like head hitting, or others, like aggression, must be prioritized for intervention due to the immediate risk they pose. Your focus is always on the client's safety and well-being first. Safety comes before everything else. Question 8. An RBT is running a skill acquisition program. The client needs a little help to make the correct response. The RBT points to the correct item. What type of prompt is this? A, physical prompt. B, model prompt. C, vocal prompt. D, gestural prompt. Answer: D, gestural prompt. This question asks you to identify a specific type of prompt. The RBT is giving help by pointing to the correct item. Pointing is a form of gesturing. Therefore, this is a gestural prompt. A physical prompt involves touching or guiding the client. A model prompt is showing the client how to do it. A vocal prompt is saying something to help. Knowing the different types of prompts helps you understand the level of assistance being provided. A gestural prompt is a visual cue from your body. Question 9. What is the main difference between continuous and discontinuous measurement? A, continuous measurement is less accurate than discontinuous measurement. B, continuous measurement records every instance of the behavior, while discontinuous measurement records only during specific intervals or moments. C, continuous measurement is used for increasing behaviors, discontinuous for decreasing behaviors. D, continuous measurement requires more RBT training than discontinuous measurement. Answer: B, continuous measurement records every instance of the behavior, while discontinuous measurement records only during specific intervals or moments. This question highlights a key distinction between different measurement approaches. Continuous means ongoing, capturing everything. Discontinuous means broken up, capturing only parts or samples of the behavior. Continuous methods, like frequency, duration, aim to record every time the behavior happens or how long each instance lasts. Discontinuous methods, like interval recording, time sampling, only note if the behavior occurred within or at the end of a set time period, not every single time. Discontinuous methods give an estimate, while continuous methods aim for a full count/timing. Continuous is all the time, discontinuous is some of the time. Question 10. Which of the following is an example of a consequence influencing future behavior? A. A child sees a toy and asks for it. B. A therapist says, "Clap your hands," and a client claps. C. A dog sits when told sit because it has received treats for doing so in the past. D. A bell ringing signals that class is over. Answer: C. A dog sits when told sit because it has received treats for doing so in the past. This question is asking you to identify where a past consequence is shown to affect future behavior. Remember the ABCs. Antecedent, behavior. Consequence. Consequences happen after a behavior and affect its future likelihood. In option C, the past consequence, receiving treats after sitting, is given as the reason the behavior, sitting, happens again when the antecedent, sit, occurs. Option A shows an antecedent leading to a behavior. Option B shows an antecedent leading to a behavior. Option D shows the stimulus acting as an antecedent, and SD, signaling a change in the environment, not a consequence affecting a specific behavior. Consequences shape future behavior. Question 11. What is stimulus control? A. The ability of a client to control their own behavior. B. When a behavior happens more often in the presence of a specific stimulus than others. C. Using a stimulus as a reinforcer. D. Prompting a behavior to occur. Answer: B. When a behavior happens more often in the presence of a specific stimulus than others. This question defines stimulus control. Stimulus control occurs when a behavior is more likely to happen when a specific stimulus, the SD or discriminative stimulus, is present compared to when it's absent or when other stimuli are present. The client's behavior is controlled by the presence or absence of this stimulus because it has reliably predicted reinforcement in the past. For example, a child might say "mommy" when they see their mom but not when they see their dad. The presence of mom has stimulus control over the mommy tact. The environment signals when a behavior will pay off. Question 12. An RBT is teaching a child to point to their shoes when asked, "Where are your shoes?" The RBT uses prompting and reinforcement. What is the natural discriminative stimulus, SD, in this program? A. The RBT giving the child a sticker. B. The RBT saying, "Where are your shoes?" C. The child pointing to their shoes. D. Seeing the shoes on the floor. Answer: B. The RBT saying, "Where are your shoes?" This question asks you to identify the natural instruction or cue for a specific behavior in a teaching program. The natural discriminative stimulus is the environmental event or instruction that should eventually trigger the target behavior without any prompts. In this scenario, the RBT, asking the question, "Where are your shoes?" is the specific verbal cue they want the child to respond to by pointing to the shoes. The sticker is the consequence/reinforcer. Pointing is the response, and seeing the shoes is part of the environmental context, but the verbal question is the direct SD. The SD is the specific cue you want the client to respond to. Question 13. When implementing a behavior intervention plan, the RBT should focus primarily on A. Determining the function of the behavior. B. Implementing the procedures as written in the plan. C. Deciding if the plan is effective. D. Changing the plan based on their own observations. Answer: B. Implementing the procedures as written in the plan. This question is about the RBT's role in implementing a behavior plan. While RBTs collect data that helps determine function and effectiveness, and their observations are valuable, the primary responsibility of the RBT is to carry out the intervention plan exactly as it was designed by the supervising BCBA/BCABA. RBTs do not determine the function or decide on changes. That is the supervisor's role. Your job is to faithfully implement the plan and collect accurate data. Follow the instructions in the plan carefully. Question 14. Which of the following behaviors is defined in the most objective and measurable way? A. The child was frustrated during the game. B. The child seemed happier today. C. The child threw toys, defined as any instance of a toy leaving the child's hand and traveling more than 1 foot, 5 times. D. The child had a bad attitude about cleaning up. Answer: C. The child threw toys, defined as any instance of a toy leaving the child's hand and traveling more than 1 foot, 5 times. This question asks you to identify the best behavior definition based on objectivity and measurability. Objective means sticking to facts. Measurable means you can count or time it. Option C provides a specific, observable action, threw toys, with a clear parameter, leaving the hand and traveling more than 1 foot, and a count 5 times. Options A, B, and D use subjective internal states, frustrated, happier, bad attitude, that cannot be directly observed or agreed upon by different observers. Good definitions are like recipes for behavior. Everyone knows what to look for. Question 15. What is the difference between positive and negative in the context of reinforcement and punishment? A. Positive means good, negative means bad. B. Positive means adding a stimulus, negative means removing a stimulus. C. Positive means the behavior increases, negative means the behavior decreases. D. Positive is used for desirable behaviors, negative for undesirable behaviors. Answer: B. Positive means adding a stimulus, negative means removing a stimulus. This question targets a common point of confusion regarding the terms positive and negative in ABA. These terms do not mean good/bad or increase/decrease. In ABA, positive always means you are adding something to the environment after the behavior occurs. Negative always means you are removing something from the environment after the behavior occurs. Whether the behavior increases, reinforcement, or decreases, punishment is determined by the effect of adding or removing that stimulus. Positive and negative just describe the action of adding or taking away. Question 16. A client often engages in hand biting when they are not actively engaged in a task. The BCBA hypothesizes the function might be automatic reinforcement, which intervention strategy might be relevant if this function is confirmed. A. Providing attention for hand biting. B. Giving a break from demands when hand biting occurs. C. Providing access to preferred items contingent on hand biting. D. Providing alternative items for the client to keep their hands busy. Answer: D. Providing alternative items for the client to keep their hands busy. This question asks about interventions related to the function of automatic reinforcement. Automatic reinforcement means the behavior itself produces a sensation or result that is reinforcing, without involving other people or getting access to external items/escape. Hand biting might feel stimulating. If the function is automatic, the intervention often involves providing a different, appropriate way for the client to get a similar sensory experience, or keeping their hands busy so they don't engage in the behavior. Options A, B, and C relate more to functions like attention, escape, or access to tangibles, respectively. If a behavior feels good intrinsically, try to find a safer replacement that also feels good. Question 17. Which measurement procedure would be best to track if a child is engaging in on-task behavior, like sitting and working, throughout a 15-minute independent work period? A. Frequency. B. Duration. C. Whole interval recording. D. Partial interval recording. Answer: C. Whole interval recording. This question asks about measuring a behavior that you want to happen continuously for a period. On-task behavior means staying engaged for a length of time. While duration could measure the total time, whole interval recording is specifically designed for behaviors you want to see occurring throughout the entire interval. You divide the 15 minutes into smaller intervals, example 1 minute each. You only mark the behavior as occurring in an interval if it happened for the whole minute. This gives you an estimate of how consistently the behavior is maintained. Partial interval is if it happens at any point, and frequency is just counting how many times it starts/stops. Use whole interval when you want the behavior to fill the whole time slot. Question 18. An RBT is teaching a client to say ball when shown a picture of a ball. When the RBT holds up the picture, the client says car. What type of response is this? A. Correct response. B. Independent response. C. Incorrect response. D. Prompted response. Answer: C. Incorrect response. This question asks you to classify the client's response during a teaching trial. The RBT gave the instruction, showed the picture, and possibly asked, "What is it?" And the client provided a response, car. However, the response did not match the target, ball. Therefore, it is an incorrect response. A correct response matches the target. An independent response is correct without prompts. A prompted response is correct with prompts. Since the client said the wrong word, it was simply incorrect. Wrong answer means incorrect response. Question 19. What is the purpose of thinning a schedule of reinforcement? A. To make the behavior happen less often. B. To make the behavior more resistant to extinction. C. To ensure the client gets reinforced for every response. D. To increase reliance on prompts. Answer: B. To make the behavior more resistant to extinction. This question is about thinning reinforcement schedules. Thinning means moving from reinforcing a behavior very often, like every time continuous reinforcement, to reinforcing it less often, like only sometimes, intermittent reinforcement. While continuous reinforcement is great for teaching a new behavior, once the behavior is established, you want to switch to intermittent schedules. Behaviors reinforced intermittently are much harder to get rid of, more resistant to extinction, because the client has learned that sometimes the behavior pays off, even if not every time. Thinning helps maintain the behavior long-term without constant rewards. Think of slot machines. They are thin schedules and hard to stop playing. Question 20. If a client engages in a behavior because it results in getting attention from adults, what is the function of the behavior? A. Escape. B. Tangible. C. Attention. D. Automatic. Answer: C. Attention. This question asks for the function of a behavior based on its consequence. The scenario states the behavior results in getting attention from adults. If the consequence that is maintaining the behavior is receiving social interaction, praise, reprimands, or any form of attention from others, then the function is attention. Escape is getting away from something unpleasant. Tangible is getting an item or activity. Automatic is the behavior itself being reinforcing. If the behavior gets a reaction from people, it's likely attention-seeking. Question 21. When implementing a behavior intervention plan that includes response blocking for a specific behavior, what is the RBT doing? A. Physically preventing the behavior from occurring. B. Ignoring the behavior. C. Reinforcing a different behavior. D. Taking away a preferred item after the behavior. Answer: A. Physically preventing the behavior from occurring. This question asks about response blocking, a physical intervention strategy. Response blocking means that the RBT physically stops the client from completing the problem behavior as soon as it starts or is about to start. For example, if the behavior is hand-to-head hitting, response blocking would involve the RBT putting their hand up to prevent the client's hand from reaching their head. Ignoring is extinction. Reinforcing a different behavior is differential reinforcement. Taking away an item is negative punishment/response cost. Response blocking is a physical stop to the action. Question 22. What is the ethical term for avoiding relationships with clients and families outside of your professional role that could harm the client or affect your judgment? A. Conflict of interest. B. Dual relationship. C. Exploitation. D. Boundary violation. Answer: B. Dual relationship. This question is about ethical conduct and professional boundaries. A dual relationship occurs when you have two different types of relationships with someone, like being their RBT and also their friend, babysitter, or business partner. The ethical guidelines strongly advise against dual relationships because they can lead to conflicts of interest, impair your professional judgment, and potentially exploit the power imbalance inherent in the therapeutic relationship. While options A, C, and D are related ethical concerns, dual relationship is the specific term for having overlapping roles. Keep your professional relationships separate from personal ones. Question 23. An RBT is preparing to run a discrete trial program. What is the typical sequence of components in a discrete trial? A. Response greater than SD greater than consequence. B. Consequence greater than SD greater than response. C. SD greater than response greater than consequence. D. Behavior greater than antecedent greater than consequence. Answer: C. SD greater than response greater than consequence. This question asks about the standard structure of a discrete trial, which is a fundamental teaching method in ABA. A discrete trial follows the ABC pattern: antecedent, behavior, consequence. But in DTT terms, the antecedent is specifically the instruction or cue, known as the discriminative stimulus, SD. So the sequence is: the RBT presents the SD. Antecedent/instruction. The client performs the response, behavior, and the RBT provides the consequence, reinforcement or correction. SD, then response, then consequence. That's the flow of one teaching trial. Question 24. When conducting a paired stimulus preference assessment, how are the potential reinforcers presented to the client? A. One item at a time. B. All items are presented together and the client chooses one. C. Two items are presented at a time and the client chooses one. D. The RBT observes what the client naturally interacts with. Answer: C. Two items are presented at a time and the client chooses one. This question is about a specific type of preference assessment called a paired stimulus assessment, also known as forced choice. The name paired stimulus is a big clue. Paired means in twos. In this method, you present two items from your list of potential reinforcers at a time, and the client chooses one. You repeat this with every possible pair of items to create a ranked list of preferences. Presenting one item at a time is a single stimulus assessment. Presenting all items together is a multiple stimulus assessment. Observing natural interaction is free operant observation. Paired stimulus means presenting items in pairs. Question 25. What is the difference between extinction and negative punishment? A. Extinction decreases behavior by removing reinforcement. Negative punishment decreases behavior by removing a pleasant stimulus contingent on the behavior. B. Extinction is used for attention-seeking behaviors. Negative punishment for tangible-seeking behaviors. C. Extinction increases behavior. Negative punishment decreases behavior. D. Extinction is the same as ignoring. Negative punishment is timeout. Answer: A. Extinction decreases behavior by removing reinforcement. Negative punishment decreases behavior by removing a pleasant stimulus contingent on the behavior. This question probes the distinction between two procedures that both result in a decrease in behavior. Extinction decreases behavior by stopping the reinforcement that was previously maintaining that specific behavior. The reinforcement is withheld. Negative punishment decreases behavior by taking away a preferred item or activity immediately after the behavior occurs. As a consequence, while ignoring can be part of extinction for attention-maintained behavior, it's not the definition of extinction itself. Negative punishment is a planned removal of a reinforcer due to the behavior. Extinction removes the source of reinforcement. Negative punishment removes a specific reinforcer. Question 26. An RBT is tracking aggression using frequency. In a 30-minute session, the client hit their head 5 times. In the next 30-minute session, they hit their head 4 times. What is the most accurate statement about the data? A. The frequency of head hitting decreased from session 1 to session 2. B. The rate of head hitting increased from session 1 to session 2. C. The duration of head hitting decreased from session 1 to session 2. D. The topography of head hitting changed. Answer. A. The frequency of head hitting decreased from session 1 to session 2. This question asks you to interpret simple frequency data across 2 equal observation periods. You are given the count, frequency, in each session. In the first 30-minute session, the frequency was 5. In the second 30-minute session, the frequency was 4. Since 4 is less than 5, the frequency of head hitting decreased from the first session to the second. Rate would be the frequency divided by time. 5/30 minutes is 4/30 minutes, still a decrease in rate. You have no information about duration or topography in the data provided. Focus on the measurement type mentioned. Question 27. What is a target behavior? A. Any behavior the client engages in. B. A behavior that has been selected for change, either to increase or decrease. C. Only challenging behaviors that need to be decreased. D. Only new skills that need to be taught. Answer. B. A behavior that has been selected for change, either to increase or decrease. This question defines a target behavior. A target behavior is not just any behavior the client does. It is a specific behavior that the BCBA and team have chosen to focus on and systematically try to change. This change could be increasing a desirable skill, like asking for help, or decreasing a challenging behavior, like aggression. It's the behavior you are specifically targeting with your intervention efforts, whether building it up or bringing it down. It's the behavior you're aiming to change. Question 28. An RBT is teaching a child colors. They hold up a red card and say red. The child says red. The RBT gives praise. Which component is the child saying red? A. Discriminative stimulus, SD. B. Response, C. Consequence. D. Motivating operation, MO. Answer. B. Response. This question uses a common teaching scenario to test the ABC components. The RBT's action of holding up the card and saying red, say red, is the antecedent, specifically the SD and prompt. The child's behavior in reaction to this instruction is the response, red. The praise given after the response is the consequence. The ML would be something that makes the child want to participate or earn the praise. The response is simply what the learner does after the instruction. Question 29. When charting data on a line graph, what does the horizontal axis, the line along the bottom, typically represent? A. The behavior being measured. B. The value or measurement of the behavior example frequency count. C. Units of time example sessions, days, dates. D. Different observers. Answer. C. Units of time example sessions, days, dates. This question asks about the parts of a graph used in ABA. The horizontal axis, or x-axis, on a line graph typically represents the passage of time. This allows you to see how the behavior changes over time. The vertical axis, or y-axis, typically represents the value or measurement of the behavior, like the frequency count, duration in minutes, or percentage correct. The behavior being measured is what's plotted using data points. The horizontal line shows the passage of time to see trends. Question 30. What is the key difference between a reinforcer and a reinforcement procedure? A. A reinforcer is the stimulus, the thing. Reinforcement is the process, what happens. B. A reinforcer only works sometimes. Reinforcement works every time. C. A reinforcer is used in positive reinforcement. Reinforcement is used in negative reinforcement. D. There is no difference. They are the same thing. Answer: A. A reinforcer is the stimulus, the thing. Reinforcement is the process, what happens. This question clarifies the distinction between the item or event and the process. A reinforcer is the thing you deliver, like a sticker, praise, break, toy. Reinforcement is the process where a behavior is followed by a reinforcer, and as a result, that behavior becomes more likely to occur in the future. The reinforcer is the tool. Reinforcement is the effect of using that tool correctly. It's like the difference between a hammer, the tool/reinforcer, and hammering a nail, the process/reinforcement. One is the noun, the other is the action and its outcome. Question 31. An RBT is working with a client who loves train videos. To increase sitting nicely during story time, the RBT allows the client to watch a train video for 5 minutes after sitting nicely for the whole story. What principle is being used? A. Punishment. B. Negative reinforcement. C. The Premack principle. Granmore's rule. D. Extinction. Answer: C. The Premack principle. Granmore's rule. This question describes a specific application of reinforcement, often called the Premack principle or Granmore's rule. This principle states that a more probable activity can be used to reinforce a less probable activity. The phrase "after sitting nicely," less probable behavior, allows the client to watch a train video. More probable/preferred activity perfectly fits this principle. It's the idea of first do this less preferred thing, then you can do this more preferred thing. Punishment decreases behavior. Negative reinforcement removes something unpleasant. Extinction withholds reinforcement. This is a classic example of using a desired activity as a reward for a less desired activity. First slash then is key. Question 32. What is a primary ethical concern when using punishment procedures? A. They are always ineffective. B. They might have undesirable side effects, such as emotional reactions or aggression. C. They are easier to implement than reinforcement. D. They only work for certain functions of behavior. Answer: B. They might have undesirable side effects, such as emotional reactions or aggression. This question addresses the ethical considerations around using punishment. While punishment can be effective in quickly decreasing behavior, ethical guidelines emphasize that it should be used cautiously, often as a last resort, and typically alongside reinforcement strategies, because it can lead to unwanted side effects. These side effects might include the client becoming upset, crying, trying to escape, or even showing aggression. It's crucial to monitor for these effects and prioritize reinforcement whenever possible. Punishment needs careful consideration because of potential negative reactions. Question 33. When teaching a child to greet others, the RBT prompts them by saying, "Say hi." This is an example of A. A tact prompt. B. An echoic prompt. C. An intraverbal prompt. D. A manned prompt. Answer: B. An echoic prompt. This question asks you to identify the type of prompt based on what the RBT says. The RBT is saying the exact word they want the child to say hi. This is an echoic prompt because it's prompting the client to repeat the verbal behavior of the RBT. A tact prompt might be showing a picture of someone waving and asking, "What do you say?" An intraverbal prompt might be, when you see someone, you say. A manned prompt would be like holding up an item the child wants and saying, "Say juice." If you're asking them to repeat you, it's an echoic prompt. Question 34. What is stimulus generalization? A. The client performs a behavior in the presence of the specific stimulus it was taught with, but no others. B. The client performs a behavior in the presence of stimuli that are similar to the training stimulus. C. The client performs a new behavior without being taught. D. The client learns to discriminate between different stimuli. Answer: B. The client performs a behavior in the presence of stimuli that are similar to the training stimulus. This question is about one type of generalization: stimulus generalization. It's when a behavior that was learned in the presence of one stimulus, the original SD, starts happening in the presence of different but similar stimuli, even though the behavior wasn't specifically taught with those new stimuli. For example, if a child learns to say dog when shown a picture of a specific dog, and then also says dog when shown pictures of different dogs they've never seen before, that's stimulus generalization. They are generalizing the response, dog, across different stimuli, pictures of dogs. The behavior spreads to similar things. Question 35. What is the term for a reinforcement schedule that delivers reinforcement after the first response that occurs after a fixed amount of time has passed? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, VI. D. Variable interval, VI. Answer: C. Fixed interval, VI. This question asks about a specific intermittent reinforcement schedule. The key phrases are after a fixed amount of time, and first response after. An interval schedule is based on the passage of time, and fixed means that amount of time is the same every time. So, a fixed interval, phi, schedule provides reinforcement for the first correct behavior that happens after a set period of time. Has passed. Example, fi 5 minutes means the first response after 5 minutes gets reinforced. Ratio schedules are based on the number of responses, not time. Fixed interval means a reward is available after a set time period. Question 36. When collecting data using partial interval recording, you mark the behavior as occurring if A. The behavior happened for the entire duration of the interval. B. The behavior happened at any point during the interval. C. The behavior was happening exactly when the interval ended. D. The behavior happened a certain number of times during the interval. Answer: B. The behavior happened at any point during the interval. This question asks about the rule for marking data in partial interval recording. The partial part means you just need to see the behavior at least part of the time within the interval. So, if the behavior occurs for even a moment during the interval, you mark it as having occurred for that interval. Whole interval requires it to happen for the entire interval. Momentary time sampling requires it to happen exactly at the end of the interval. Partial interval is the most forgiving. Just show up in the interval. Question 37. What is the purpose of a functional analysis? A. To determine if a behavior plan is being implemented correctly. B. To identify potential reinforcers for a client. C. To experimentally determine the function of a behavior by arranging different test conditions. D. To measure the frequency of a behavior in different settings. Answer: C. To experimentally determine the function of a behavior by arranging different test conditions. This question is about a specific, more advanced type of functional assessment. While a functional behavior assessment, FBA, involves gathering information about the function, a functional analysis is a more precise method where the BCBA sets up different situations. Test conditions like attention, escape, tangible, alone, to see which one makes the behavior happen most often. This helps experimentally prove the function. It's different from just gathering observation data or doing interviews. It's like conducting mini experiments to find the why. A functional analysis is the experiment to find the function. Question 38. Which prompt is generally considered the least intrusive? A. Full physical prompt. B. Gestural prompt. C. Vocal prompt. D. Model prompt. Answer: B. Gestural prompt. This question asks about the prompt hierarchy and which prompt gives the minimal amount of help. Prompt intrusiveness refers to how much guidance is provided and how physical it is. A full physical prompt is the most intrusive, guiding the whole movement. A gestural prompt, like pointing, provides less direct assistance compared to vocal, saying something, or model, showing how. While vocal prompts can sometimes be considered less intrusive depending on the context, gestural prompts are often near the bottom of the intrusiveness scale because they are often subtle visual cues. Think of what provides the least amount of doing it for them. Pointing is often the least help. Question 39. When teaching a child to put on a shirt, you start by helping them with all steps except the last one, pulling the shirt down. Once they can do that, you help with all steps except the last two, and so on. What type of chaining is this? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer: B. Backward chaining. This question describes backward chaining. In backward chaining, you teach the steps of a task analysis, starting from the last step and working backward. The RBT does most of the task, allowing the client to complete the final step independently and receive reinforcement. Then the RBT does all but the last two steps, and the client does those, and so on. The example clearly states starting with the last step and then the last two steps. This is the hallmark of backward chaining. Question 40. What is the best strategy for promoting generalization of a skill? A. Only teach the skill in one specific setting. B. Use only one specific reinforcer for the skill. C. Vary the teaching environment, materials, and people involved. D. Stop reinforcing the skill once it is learned. Answer: C. Vary the teaching environment, materials, and people involved. This question asks how to help a skill show up in places and ways it wasn't specifically taught. Generalization is about the skill spreading. To encourage a skill to happen in different situations, you should deliberately introduce variety during teaching. Teach the skill in different rooms, use slightly different instructions or materials, and have different people work on the skill. If you only teach it one way, the client might learn to do the skill only in that specific way or place. Varying things helps the client understand the skill applies more broadly. Mix things up so the skill travels. Question 41. When is it ethically permissible to use aversive procedures or punishment? A. Whenever the RBT believes it will be effective. B. When positive reinforcement has been tried and documented as ineffective, and the behavior is serious, and the procedure is part of a plan supervised by a BCBA. C. Only if the parents request it. D. Never. ABA only uses positive reinforcement. Answer: B. When positive reinforcement has been tried and documented as ineffective, and the behavior is serious, and the procedure is part of a plan supervised by a BCBA. This question addresses the strict ethical guidelines around punishment and aversive procedures. These interventions are considered ethically sensitive and should only be used when less intrusive reinforcement-based strategies have been attempted and proven insufficient to address a significant or dangerous behavior. They must always be part of a detailed plan, developed and closely supervised by a qualified BCBA, and the RBT must be trained to implement them correctly. You can't just use punishment because you think it might work. It's a serious decision based on data and supervised expertise, usually for behaviors that pose a risk. Punishment is a highly regulated tool used only under specific conditions. Question 42. A client screams when asked to transition to a new activity. When they scream, the RBT usually lets them stay at the current activity for a few more minutes. This results in the screaming continuing to happen during transitions. What is the likely function of the screaming? A. Attention. B. Escape. C. Tangible. D. Automatic. Answer: B. Escape. This question gives a scenario and asks you to determine the function based on the consequence. The behavior is screaming during transitions. The consequence is getting to stay at the current activity, meaning they successfully avoid or delay the transition, which is likely an unpleasant demand or situation for them. Since the screaming results in escaping or avoiding something disliked, the function is escape. Attention would be if the screaming resulted in social interaction. Tangible is getting an item. Automatic is internal. If the behavior gets them out of something, it's escape. Question 43. If a behavior happens every time the client is asked to do something, but almost never happens when they are not given an instruction, this suggests the behavior is under what kind of control? A. Reinforcement control. B. Punishment control. C. Stimulus control. D. Motivating operation control. Answer: C. Stimulus control. This question asks about what controls when a behavior occurs based on environmental cues. The behavior is happening reliably in the presence of a specific stimulus when asked to do something, but not in its absence. This means the when asked stimulus has gained control over the likelihood of the behavior. This is the definition of stimulus control. Reinforcement and punishment describe why a behavior happens more or less in general, but stimulus control describes when it happens based on cues. An MO changes how much you want something, affecting behavior related to getting it. Stimulus control is about the environment signaling when the behavior is appropriate or will be reinforced. The environment tells the behavior when to appear. Question 44. What is the difference between topography and function of a behavior? A. Topography is what the behavior looks like. Function is why the behavior occurs. B. Topography is why the behavior occurs. Function is what the behavior looks like. C. Topography is how often a behavior occurs. Function is how long it lasts. D. There is no difference. They are the same thing. Answer: A. Topography is what the behavior looks like. Function is why the behavior occurs. This question asks about two different ways to describe and analyze behavior. Topography describes the physical form or movements of the behavior, what you see and hear, example, raising hand and striking surface. Function describes the purpose or reason the behavior is happening for the individual, example, to get attention, to escape a task. A behavior might look different ways but serve the same function, example, screaming or hitting could both be for attention. Or behaviors that look similar could serve different functions. Understanding both is important, but they are distinct concepts. What it looks like is why it happens. Question 45. When implementing a teaching procedure, the RBT says, touch your head, and the client immediately touches their head. The RBT provides enthusiastic praise. What happened that makes the praise positive reinforcement for touching the head? A. Something was added. Praise. After the behavior, and the behavior is likely to increase. B. Something was removed. Demand. After the behavior, and the behavior is likely to increase. C. Something was added. Praise. After the behavior, and the behavior is likely to decrease. D. Something was removed. Item. After the behavior, and the behavior is likely to decrease. Answer: A. Something was added. Praise. After the behavior, and the behavior is likely to increase. This question asks you to apply the definition of positive reinforcement to a scenario. Reinforcement increases behavior. Positive means adding something. The praise is something being added to the environment after the behavior, touching the head. Assuming this makes the child more likely to touch their head when asked in the future, which is the goal of reinforcement. It fits the definition of positive reinforcement. It's adding a good thing to make the behavior grow. Question 46. What is the definition of an unconditioned reinforcer? A. A reinforcer that has been paired with other reinforcers and has become reinforcing through learning. B. A reinforcer that is delivered only after an average number of responses. C. A reinforcer that is naturally reinforcing without any prior learning. D. A reinforcer that is effective the first time it is presented only in certain conditions. Answer C. A reinforcer that is naturally reinforcing without any prior learning. This question asks about unconditioned reinforcers, also called primary reinforcers. These are things that are inherently reinforcing because they are tied to basic biological needs or survival, and their reinforcing value is not learned. Examples include food, water, warmth, and pain reduction. They are effective the first time they are encountered if the person is in a state of deprivation. Hungry, thirsty, cold, conditioned reinforcers, like praise, tokens, gain their value through learning. Unconditioned means it works naturally, without teaching. Question 47. An RBT is observing a client who frequently makes loud, disruptive noises during class. The RBT marks an interval as having the behavior if the noise occurs at any point during that interval. What measurement method is being used? A. Whole interval recording. B. Momentary time sampling. C. Frequency. D. Partial interval recording. Answer D. Partial interval recording. This question describes the method of partial interval recording. The key phrase is if the noise occurs at any point during that interval. This is the defining characteristic of partial interval recording. Whole interval requires the behavior for the entire interval. Momentary time sampling records if it happens exactly at the end of the interval. Frequency counts every instance. This method is useful for estimating the occurrence of high-rate behaviors or behaviors that don't last long. Any little bit in the interval counts. Question 48. What is the difference between a mand and a tact? A. A mand is asking for something you want, controlled by a desire, MO. A tact is labeling something you perceive, controlled by the item itself, SD. B. A mand is controlled by what someone else says. A tact is asking for something. C. A mand is labeling an item. A tact is repeating what someone says. D. A mand decreases behavior. A tact increases behavior. Answer A. A mand is asking for something you want, controlled by a desire, MO. A tact is labeling something you perceive, controlled by the item itself, SD. This question asks for the distinction between two key verbal operants. A mand is controlled by a motivating operation, MO. You want or need something. So you ask for an example, you're thirsty. MO. You say water. A tact is controlled by a nonverbal stimulus in the environment. In SD, you see, hear, smell, etc. something and label it example, you see a dog. SD, you say dog. The key difference is the controlling variable. Mands are driven by desire, MO. Tacts are driven by the environment, SD. Mands are requests, tacts are labels. Question 49. What is the purpose of a baseline phase in a behavior graph? A. To demonstrate the effectiveness of the intervention. B. To show the level of the behavior before the intervention is implemented. C. To show different interventions being used. D. To identify the function of the behavior. Answer B. To show the level of the behavior before the intervention is implemented. This question asks about the baseline phase in data graphing. The baseline is the initial period of observation, where data is collected on the target behavior before any new intervention or treatment is started. It shows you the natural occurrence or level of the behavior under current conditions. This serves as a crucial point of comparison for when the intervention is introduced. You can see if the intervention is actually causing the behavior to change compared to its baseline level. Baseline is the starting point before you try to change things. Question 50. When preparing for a session, the RBT should review the behavior plan and skill acquisition plans, gather materials, and A. Decide which plans they feel like working on today. B. Determine the client's reinforcement schedule for the day. C. Ensure they have communicated with the client's parent/caregiver about personal issues. D. Review notes from previous sessions and recent data. Answer D. Review notes from previous sessions and recent data. This question asks about session preparation for an RBT. Besides reviewing the plans and gathering materials, it's important to review what happened in prior sessions and look at the recent data trends. This helps you know where the client left off, what progress was made or wasn't, and if there were any relevant incidents or notes from colleagues. This information guides your session and ensures continuity of care. Your supervisor determines the reinforcement schedule. Personal issues with parents are not part of session prep. Maintain boundaries, and you should follow the plans, not choose based on preference. Preparation includes catching up on the client's recent journey. Question 51. Which scenario is an example of establishing operation? EO. A. Giving a child a toy they like after they ask for it. B. Telling a child, touch blue, and they touch the blue card. C. Not giving a child a preferred snack all morning, making them more likely to ask for it. D. Taking away a toy when a child throws it, making them less likely to throw toys. Answer: C. Not giving a child a preferred snack all morning, making them more likely to ask for it. This question asks you to identify an establishing operation, EO, which is a type of motivating operation, MO. EOs increase the effectiveness of a reinforcer and make behaviors that have previously resulted in that reinforcer more likely. In option C, depriving the child of a snack, EO, makes the snack more reinforcing and increases the likelihood of behaviors associated with getting the snack, like asking for it. Option A is positive reinforcement. Option B is an SD and response. Option D is punishment. EOs make you want something more, which drives behavior to get it. Question 52. What is the main purpose of collecting interim server agreement, IOA? A. To confuse the RBTs collecting data. B. To ensure data is reliable and that different observers are recording the behavior the same way. C. To compare the RBT's data to the client's data. D. To determine if the intervention is effective. Answer: B. To ensure data is reliable and that different observers are recording the behavior the same way. This question asks about inter-observer agreement, IOA. IOA is when two or more observers independently collect data on the same behavior at the same time. Comparing their data helps determine if the behavior definition is clear enough and if the observers are collecting data accurately and consistently. High IOA means the data is reliable. You can trust that the behavior is being measured consistently regardless of who is watching. It's a check to make sure everyone sees and records the behavior the same way. Question 53. An RBT is teaching a client to follow the instruction, stand up. The RBT says stand up and gently lifts the client from their seat. What type of prompt is the gentle lift? A. Model prompt. B. Vocal prompt. C. Physical prompt. D. Positional prompt. Answer: C. Physical prompt. This question asks about prompt types again. The RBT is using gentle lifts, which involves physically touching and guiding the client's body to perform the movement of standing up. Any prompt that involves physical contact to guide the client is a physical prompt. Model is showing, vocal is saying, positional is placing items closer to the client. Physical prompts involve direct touch to help them do the action. Question 54. What is the goal of using reinforcement in a skill acquisition plan? A. To make sure the client likes the RBT. B. To decrease inappropriate behaviors. C. To increase the future likelihood of the client performing the target skill correctly. D. To allow the client to access preferred items whenever they want. Answer: C. To increase the future likelihood of the client performing the target skill correctly. This question asks about the purpose of reinforcement when teaching new skills. In skill acquisition, reinforcement is used to strengthen the desired response, the correct performance of the skill, so that the client is more likely to perform it again in the future when given the instruction. It's about making the correct response more probable. While preferred items might be used as reinforcers, the goal isn't just free access. It's to make the skill happen more often. Reinforcement makes good skills happen more. Question 55. Which of the following is not a common function of behavior identified in ABA? A. Attention. B. Escape. C. Confusion. D. Tangible. Answer C. Confusion. This question asks you to identify something that is not typically considered one of the four main functions of behavior in ABA. The common functions are attention, getting social interaction; escape/avoidance, getting away from something unpleasant; tangible, getting an item or activity; and automatic, the behavior itself is reinforcing, often sensory. Confusion is an internal state and not a consequence that maintains a behavior in the same way as the other options. While confusion might precede a behavior, it's not the maintaining consequence. The four main functions explain why behavior keeps happening. Question 56. When you reinforce the first response after a varying amount of time has passed, on average, what schedule of reinforcement are you using? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer D. Variable interval, VI. This question describes the variable interval, VI, reinforcement schedule. Interval means based on time, and variable means the amount of time changes each time, but averages out to a specific duration. You reinforce the first response that occurs after this changing amount of time has passed. For example, on a VI 5-minute schedule, reinforcement might be available after 3 minutes, then 7 minutes, then 4 minutes, then 6 minutes, averaging 5 minutes. You never know exactly when the time is up, but you have to respond to get the reward once it is available. It's time-based, but unpredictable. Question 57. What is one important ethical principle related to the responsibility to clients? A. Prioritizing the RBT's convenience over the client's needs. B. Always acting in the best interest of the client. C. Sharing client information freely with friends and family. D. Using the most restrictive procedures first to quickly change behavior. Answer B. Always acting in the best interest of the client. This question highlights a core ethical responsibility of RBTs. The principle of responsibility to clients means that your actions and decisions should always prioritize what is best for the client's well-being, growth, and safety. This outweighs your personal convenience or preferences. Sharing confidential information and using restrictive procedures without proper justification and planning are ethical violations. Your client's needs and welfare are your top priority. Their best interest guides your work. Question 58. An RBT is teaching a client to imitate actions. The RBT claps their hands and says, "Do this." The client then claps their hands. What verbal operant is the RBT using by saying, "Do this"? A. Mand. B. Tact. C. Etroic. D. Intraverbal. Answer A. Mand. This question asks about the RBT's verbal behavior in prompting. While the target behavior is imitation, a nonverbal skill, the RBT's instruction, "Do this," is a request or command for the client to perform an action. Because it's a request for a specific behavior that the client can then get reinforced for, it functions as a command from the RBT to the client. The client's subsequent clapping is an example of imitation. The RBT's verbal behavior is a request/command. Question 59. What is the key feature of a crisis intervention plan? A. It outlines how to teach replacement behaviors. B. It details strategies for responding to imminent danger from severe behavior. C. It describes preferred items for reinforcement. D. It explains how to collect data on low-rate behaviors. Answer B. It details strategies for responding to imminent danger from severe behavior. This question asks about the specific purpose of a crisis intervention plan. These plans are not about teaching new skills or choosing reinforcers. They are specifically developed to guide staff on how to safely manage a situation where the client's behavior poses a serious and immediate risk of harm, a crisis. They prioritize safety and de-escalation during dangerous incidents. Crisis plans are for emergency situations when safety is at risk. Question 60. An RBT is teaching a child to say thank you. They provide reinforcement after every 5th time the child says thank you. What schedule of reinforcement is being used? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: A. Fixed ratio, FR. This question describes a fixed ratio, FR, schedule. The reinforcement is based on the number of responses, every 5th time, making it a ratio schedule. The number is fixed at 5, meaning it's always after exactly 5 responses, so it's a fixed ratio 5. FR5. Schedule. Variable ratio would be an average number. Interval schedules are based on time. Fixed ratio means a set number of actions gets the prize. Question 61. What is the ethical responsibility of an RBT regarding maintaining their RBT certification? A. The certification is permanent once earned. B. The RBT must complete ongoing supervision and renewal requirements. C. The RBT only needs to notify their supervisor if they lose their certification. D. Maintaining certification is optional if the RBT feels competent. Answer: B. The RBT must complete ongoing supervision and renewal requirements. This question addresses the ethical requirement to maintain professional credentials. The RBT certification is not permanent. RBTs are required by the certifying body, the BASB, to receive ongoing supervision from a qualified supervisor, BCBA/BCABA, and to complete renewal requirements periodically, including completing the renewal application and potentially additional training or competency assessments. Failing to meet these requirements means you are no longer certified and cannot practice as an RBT. Staying certified requires ongoing effort and supervision. Question 62. A client learns to label a picture of a car when shown the picture. Later, they see a real car outside and say car. This is an example of A. Discrimination. B. Stimulus generalization. C. Response generalization. D. Prompt fading. Answer: B. Stimulus generalization. This question gives an example of stimulus generalization. The client learned the behavior, saying car, in the presence of one stimulus, a picture of a car. The behavior then occurred in the presence of a different but similar stimulus, a real car. This is the definition of stimulus generalization. The response generalizes across similar stimuli. Discrimination is responding differently to different stimuli. Response generalization is performing a different but related behavior. Prompt fading is reducing help. The learned label spread to a new example of the thing. Question 63. When writing a behavior definition, why is it important to include examples and non-examples? A. To make the definition longer and more impressive. B. To help clarify what is and is not the target behavior, improving measurement consistency. C. To teach the client about the definition. D. To show the behavior's function. Answer: B. To help clarify what is and is not the target behavior, improving measurement consistency. This question is about making behavior definitions effective. While the core definition should be objective and measurable, adding examples, clear instances of the behavior, and non-examples, things that might look similar but are not the behavior, further clarifies the boundaries of the definition. This is especially helpful when the behavior might be easily confused with other actions. Clear examples and non-examples help different people agree on exactly when the behavior occurred, leading to more consistent and accurate data collection. Examples and non-examples draw the line around the behavior. Question 64. What is the main purpose of conducting direct observation as part of functional behavior assessment, FBA? A. To punish the behavior in the natural environment. B. To see the behavior happening in its natural context and collect data on ABCs. C. To teach replacement behaviors during the assessment. D. To identify preferred items the client likes. Answer: B. To see the behavior happening in its natural context and collect data on ABCs. This question asks about direct observation, a common method in FBAs. Direct observation involves watching the client in their typical environment where the behavior occurs. The main goal is to see the behavior firsthand, notice what happens right before, antecedents, and right after, consequences, in the real-world setting, and collect objective data on these events and the behavior itself. This provides valuable information about the conditions under which the behavior is most and least likely to occur. Seeing it happen in person gives you the best picture. Question 65. Which term refers to a decrease in the value of a reinforcer due to overexposure or satiation? A. Deprivation. B. Abolishing operation, AO. C. Establishing operation, EO. D. Extinction. Answer: B. Abolishing operation, AO. This question asks about how the value of a reinforcer can change, specifically decrease. An abolishing operation, AO, is a type of motivating operation, MO, that decreases the effectiveness of a reinforcer and makes behaviors that have previously resulted in that reinforcer less likely. Satiation, having too much of something, is a classic example of an AO. If a child has just eaten a large meal, food, a reinforcer becomes less valuable and behaviors related to getting food become less likely. Deprivation, not having something, is the opposite, in EO, increasing the value. Extinction is about the behavior decreasing because reinforcement is withheld, not the value of the reinforcer changing. AOs make you want things less. Question 66. An RBT is collecting data using momentary time, sampling on a child who often stands up during circle time. The interval is set to 1 minute, the timer beeps, and the child is sitting down. How should the RBT mark the data for that interval? A. Mark that the behavior, standing, occurred. B. Mark that the behavior, standing, did not occur. C. Mark that a different behavior occurred. D. Do not mark anything for that interval. Answer: B. Mark that the behavior, standing, did not occur. This question tests your understanding of momentary time sampling rules. The behavior being measured is standing up. With MTS, you only record if the behavior is happening exactly at the moment the timer beeps. In this scenario, the child was sitting down when the timer beeped, meaning the target behavior, standing up, was not happening at that specific moment. Therefore, you mark that the behavior did not occur for that interval. The behavior must be happening right at the end of the interval to be marked as occurring. At the beep, check if the behavior is happening right then. Question 67. What is required for a consequence to function as punishment? A. It must be something the client dislikes. B. It must involve adding an aversive stimulus. C. It must decrease the future likelihood of the behavior it follows. D. It must be delivered immediately after the behavior. Answer: C. It must decrease the future likelihood of the behavior it follows. This question asks about the defining characteristic of punishment. While consequences used for punishment are often things the client dislikes, and they can involve adding something unpleasant, positive punishment, or removing something pleasant, negative punishment. The definition of punishment is based solely on its effect on the behavior. If a consequence makes the behavior happen less often in the future, then it functioned as punishment, regardless of the RBT's intention or what the consequence was. The effect on the behavior is what matters. Question 68. When should an RBT document an incident, such as a client injury or a significant behavioral event that poses a risk? A. Only if the supervisor is present. B. Only if it is a major injury requiring medical attention. C. Immediately after the incident occurs, following company protocol. D. At the end of the week during supervision. Answer: C. Immediately after the incident occurs, following company protocol. This question is about ethical and professional requirements for reporting incidents. Any incident involving client safety, injury, no matter how minor, or significant behavioral crisis must be documented promptly and accurately according to your organization's procedures. Waiting can lead to forgotten details or inaccuracies. You should report and document immediately and then inform your supervisor as soon as possible. Prompt reporting ensures client safety and proper response. Don't delay reporting safety incidents. Question 69. What is the difference between response generalization and stimulus generalization? A. Response generalization is doing the same behavior in different situations. Stimulus generalization is doing different behaviors in the same situation. B. Response generalization is doing different but functionally equivalent behaviors in the same situation. Stimulus generalization is doing the same behavior in different but similar situations. C. Response generalization is using the behavior only with specific people. Stimulus generalization is using the behavior only in specific places. D. There is no difference. They are both just called generalization. Answer: B. Response generalization is doing different but functionally equivalent behaviors in the same situation. Stimulus generalization is doing the same behavior in different but similar situations. This question clarifies two types of generalization. Stimulus generalization, as covered in Q34, is when the same behavior occurs in response to different, similar stimuli or situations. Response generalization is when, in the presence of the same stimulus, the client performs a different but related behavior that serves the same function or achieves the same outcome, functionally equivalent. For example, if a child is taught to say cookie to request a cookie, and then starts signing cookie or pointing to a cookie when they want one, that's response generalization. Different behavior, same outcome, getting a cookie. Response is different actions, stimulus is different cues. Question 70. When creating a behavior reduction plan for a challenging behavior, what is the essential first step after identifying the behavior? A. Choose the most powerful punisher. B. Implement extinction immediately. C. Conduct an assessment to determine the function of the behavior. D. Teach a replacement behavior. Answer: C. Conduct an assessment to determine the function of the behavior. This question asks about the necessary steps when addressing a challenging behavior. Before you choose any intervention, like punishment, extinction, or teaching a replacement behavior, it is crucial to understand why the behavior is happening, its function. The intervention chosen must match the function. An assessment, like an FBA or functional analysis, is necessary to determine if the behavior is happening for attention, escape, tangibles, or automatic reinforcement. You need to know the why before you can figure out the how to change it. You can't fix it if you don't know why it's happening. Question 71. An RBT is teaching a client to initiate greetings. When a familiar person approaches, the RBT says, "Hi," hoping the client will imitate. This is an example of using which prompt strategy? A. Least to most prompting. B. Most to least prompting. C. Stimulus prompt. D. Response prompt. Answer: D. Response prompt. This question asks you to classify the type of prompt based on when it occurs relative to the client's response. A response prompt is a prompt that operates directly on the behavior itself to help the client make the correct response. In this case, the RBT is providing a model, "Hi," and a vocal instruction, "Say hi," to help the client perform the target behavior, saying hi. A stimulus prompt operates on the SD or the environment to make the correct response more obvious. Least to most and most to least are prompt fading strategies, not types of prompts themselves. Since the prompt is guiding the response, it's a response prompt. Question 72. If a client learns to say cat when shown a picture of a cat, but does not say cat when shown a picture of a dog, this is an example of A. Generalization, E. Discrimination, C. Shaping, D. Extinction. Answer B. Discrimination. This question describes discrimination. Discrimination is when a behavior occurs more often in the presence of one stimulus, the picture of the cat, the SD, than in the presence of another stimulus, the picture of the dog, which might be an S delta or SD. The client is learning to respond differently to different stimuli. Generalization is the opposite, responding the same way to similar stimuli. Shaping is building a new behavior, and extinction is decreasing behavior by removing reinforcement. They are discriminating between the picture of the cat and the picture of the dog. Know the difference between this and that. Question 73. What is the ethical guideline regarding maintaining records? A. RBTs should discard records once a client's services end. B. Records should be maintained for a specific period as required by law and policy. C. Records only need to be maintained if the client's progress is slow. D. RBTs are not responsible for maintaining records. Only supervisors are. Answer B. Records should be maintained for a specific period as required by law and policy. This question addresses the ethical and legal requirements for record keeping. RBTs, under supervision, are responsible for collecting and maintaining accurate data and session notes. These records are crucial for the client's ongoing care, for supervisors to monitor progress, and are legal documents. Ethical standards and regulations require that client records be stored securely and maintained for a specific number of years after services end, according to local, state, and federal laws, as well as organizational policies. You can't just throw away records when a case closes. Proper record keeping is essential and legally mandated. Question 74. A child is taught to say train when they see a train. This is an example of which verbal operant? A. Manned. B. Tact. C. Echoic. D. Intraverbal. Answer B. Tact. This question describes a tact. The child is learning to label or name something they see in the environment. A train. This behavior, saying train, is controlled by the presence of the nonverbal stimulus, the train. Mands are requests, asking for a train. Echoics are repeating someone saying train. Intraverbals are conversational, like answering what rides on tracks. Labeling something you perceive with your senses is a tact. See it, name it, that's a tact. Question 75. When an RBT is observing a client in their natural environment and simply notes what happens without trying to manipulate anything, what type of assessment is this? A. Functional analysis. B. Direct observation example ABC data collection. C. Preference assessment. D. Skills assessment. Answer B. Direct observation example ABC data collection. This question asks about a method of assessment where the RBT is watching and recording behavior as it naturally happens. The key phrase is observing in their natural environment and simply notes what happens without trying to manipulate anything. This describes a direct observation of the behavior in its usual setting. ABC data collection is a common way to do this. A functional analysis does involve manipulating the environment. A preference assessment identifies reinforcers. A skills assessment evaluates what skills a client has. Direct observation is simply watching and recording what's already happening. Just watch and record.